I am Dr. Kaushal Singh. I am a neuroendoscopic spine surgeon and practicing in Aligarh. So my today's talk is on Monoportal Interlaminar Lumbar surgery instruments. So we'll be seeing what instrumentation and what armamentarium you should have. So I am dividing my talks into the following points, and we'll be discussing all these points one by one. So the first and the foremost and the most important instrument, and of course the most costly instrument, is the working channel endoscope. So it is called a working channel endoscope because it has a lumen through which you have to pass your instruments, and you have to work through this corridor only. So this working channel endoscope is divided into 4 parts: the optical system, the illumination assembly, the irrigation channels, and the working channel. So you can see in the center we have the large hole, which is the working channel. Then in the sides we have the irrigation channels. In the center, the small is the light, that is the illumination assembly. Now the working channel endoscopes can be of different type depending upon where we are operating. We can be operating on the cervical spine, thoracic spine, or the lumbar spine. So the length of the endoscope in lumbar spine can be from 150 to 180 mm. The outer diameter can range from 5 mm to 10 mm. The inner diameter may range from 3 mm to 8 mm. The irrigation channel diameter is usually 1.5 into 1 mm. And the angle of view is very important. It can range from anywhere from 12 to 25 degrees. Usually it is 15 degree or 25 degrees, from which the anatomy is best described. So this is a endoscope, and you can see the various ports. The shaft has the rod length system. Then there is the irrigation port, the camera assembly, the black colored, and the blue colored is the working channel. So this is the schematic representation of the endoscope and its parts. You can see the rodless assembly, which lodges in the shaft, and which actually makes the image. Then the second assembly is the illumination and the video equipments. Now we have a lot of 4K video systems that are available, which helps us in seeing the anatomy properly so that we can operate in the precise manner. I have this assembly. It is not 4K, it is just a full SD system. It is a all-in-one system. So the assembly is connected to the endoscope through a fiber optic cable. The blue color cable is the fiber optic cable. And then it is connected to a digital image processor. This digital image processor converts the signal received from the endoscope into a working image, which is projected onto the monitor. Then one part which is optional, but many people use it, is the fluid pump. Normally, like I don't have a fluid pump, I am doing it manually by taking a gravity assist. But fluid pump gives you accuracy and gives you more. You can set the pressure by yourself. So it is kind of arthro pump with a pressure set at 30 to 50 mm, and by using this pump we can control the irrigation so that we can remove the debris which is generated during surgery. We can remove the bone pieces as well, and also we can clear off the blood which is generated, and we can clear off our field of view. It should be remembered that the pressure of the pump should always be less than the diastolic pressure of the person that is being operated. Then the basic surgical instrument. So this is a whole set of the instrument that you will be requiring for the endoscopic spine surgery. So these are the various instruments. I will be discussing these instruments one by one. So this is a single channel dilator with oblique working sleeve. As you can see, this is the working sleeve is oblique, so that we can see at an angle and our view is not obstructed. Then it has a dilator to dilate the muscles and the soft tissues, and the tip, as you can see, has a different marking, so we have a orientation while we are operating, where we are while operating. We don't get lost. Then this is a grasper. We can see there is a single action jaw at the tip. It is used to remove the soft tissues. It can be used to remove the ligamentum flavum, and it doubles down as a tubular disc plunger. We can remove the disc material as well. Then the Carson Ronger, all spine surgeons' favorite instrument in open spine surgery as well. Here the length is a bit long because we have to work through a long corridor. So as you can see here, the Carson Ronger are either obtuse angled, which are used to remove the bony part, or it can be 90-degree angle, which is usually used to remove the ligamentum flavum. It can be made of stainless steel or titanium. The black color is the titanium one. So this video is showing the various parts of the Carson Ronger. The tip is a sharp obtuse angled tip for removing the bone, and then the shaft, which has usually have markings, so you can know how much deep you are working. Then this is neurosurgeon's best friend. In open brain surgery, open spine surgery, we are using it a lot. It's a pan-field retractor or dissector. Even in spine surgery, we use it to remove the dissect the ligamentum flavum, soft tissues, as well as to handle the thicker sac. Then this is a osteotome. It is elongated. It is used as a chisel to obtain the bone if we are doing fusion surgery. Also, we can use it as a replacement of a drill. It is not a complete replacement, but it will do the work if you are not able to use the drill for some reason. Then we have a up angled curate, which is the most commonly used. So it has a up angle, as you can see here, slightly bent forwards. Different versions are available with different angulations. It is used for dissecting the soft tissue as well, and for probing out. Then we have a right angle micro ball tip probe. As you can see in this video, it is small probe, it is blunt, and again is used for dissection. Then this is a right angle blunt tip probe, also used for dissection. Then tubular nerve root retractor is there. As you can see, it has a hole at its top, so through which you can pass your instruments. Then at the tip, it is open so that you can visualize the end of the tip and do your work. So this is showing the various parts of the nerve root retractor. It is used to medialize the root, to medialize the thecal sac, so that you can remove the disc properly. We are passing an instrument. It is a flavum knife through this instrument, just for a demo that how the instrument passes through it. Then this is a tubular through-cut forceps. So this through-cut forceps can be used to remove the ligamentum flavum. It can also be used to cut the annulus, and we can also remove the calcified disc using this through-cut forceps. This is a flavum knife. It is blunt. It is not very sharp, but it is adequately sharp that we can split through the ligamentum flavum and see the thecal sac properly. Then one very important instrument that is required in endoscopy is a diathermy, or it is used for coagulation and hemostasis. It has various versions, but the most commonly used the bipolar radiofrequency electrocoagulator surgical systems. Then we have the plasma systems. Laser systems are also available, and then we have the accessories, that is the radiofrequency electrodes, probes, and cannons. So here the first one that you can see is the radiofrequency machine, and the other one is the plasma machine. Now, as the radiofrequency ablator that we are using comes in various strength depending upon the frequency. It comes from 300 kilohertz to 4 megahertz. Now, research has shown that as you increase the frequency, the heat generated is decreased. So the 4 megahertz frequency is optimal, in which minimal heat is generated. So in the surrounding 2.5 mm area where your root may lie or your thecal sac may lie, minimum heat is generated, and there is less chances, minimal chances of injury of the root of the thecal sac and other structures. Then this shows the various modes that can be available. But most commonly we are using the hemocoagulation 4 megahertz square wave rectified mode at 60 watts. This is the system that I have. It is just a working system. So it is showing the various probes. This is a side firing probe that we use for tissue dissection. The next one is the front firing probe. and the last one is the retractable angled probe. The front firing probe, the side firing probe, and the retractable probe. This retractable probe is used inside the disc space and can pass through the nerve sleeve. It is so much narrow that it can pass through the nerve sleeve. It is also used for the foraminoplasty. Then we have endoscopic motorized systems, that is the drill and the shiver system. Here it is shown the striker core system and the core 2 system. Core 2 is the latest version. So the various motorized burrs can be attached to the system, and we can do our bone work. We can remove the calcified disc material as well, and we can use it in cases of this fusion as well. And the burrs that are available in various sizes, starting from 1 mm to 5 mm. When you decrease the size of the burr, your precision increases, but the work speed decreases actually. But when you are working with larger burrs, your speed increases but the accuracy decreases. Then we have two types of burrs that we are usually using. This is my endoscopic drill system with various attachments. So this is the sheath through which we are passing a cutting burr, as you can see, and you can see a white colored which is a energy dissipator. It dampens the vibrations so that it doesn't wobble. This is the diamond burr, as you can see. It is used for fine work. Usually when we start with the cutting burr, and when we are doing fine work or we are near the thecal sac or we have opened the ligamentous fluor, then we move on to the diamond burr. So these are the various attachments required for the burr. Then of course, if you are investing into such a costly setup, you should have a good instrument holder. So this is the autoclavable instrument holder with silicone inserts and the bridge, so you can safely store all your instruments and use them whenever required in a safe manner and autoclave them. So this is a frequently asked question, that what is the cost of the system that you will be purchasing. So the initial investment may range from 10 to 15 lakhs if you go for some lower end instruments, but they will work. I had a bad experience when I started transformer surgery. I eventually abandoned it, so I decided I will go for good instruments. So my initial investment was roughly 25 to 30 lakhs into my setup. But camera system can be available through the hospitals, so you don't need to buy it separately. Then finally, how you use these instruments in the OT, how you put them. So the surgeon and the scrub nurse with a myo trolley stand on the side of the pathology. Across from the surgeon stands the X-ray technician with a mobile or mounted C-arm, and the anesthesia team stands at the hand of the patient with the anesthetic trolley. So you can see the irrigation instrument, the video equipment, and the image processing unit in front of the surgeon, opposite the surgeon. So the surgeon is standing on the side of the pathology and operating the patient. Thank you very much.